Hello, friends. I am Dr NJWEIPI chegou. I am a medical doctor and I'm a GI tract proctology surgeon. Today, I bring to you the health tidbits. And our topic of discussion today is the benefits of intermittent fasting. Now, we have to understand that fasting is a physiological activity of the body. What I mean is that all of us, to an extent, do some sort of fasting. Since fasting means that it is the time that you are not eating. And so, since all of us during the day have some time to sleep and that we don't eat during the sleep, it means that we are doing some fasting. But then, if you want to stay healthy and you want to come out of some diseased situation, then you have to practice intermittent fasting in the correct way. Now, we know that when you eat carbohydrates, there is glucose that is supplied to your bloodstream. And this glucose is the one that goes and triggers the secretion of insulin from the pancreas. Now, when you are taking less carbohydrates, what it means otherwise is that the glucose level in your blood is going to reduce. And when the glucose level in your blood reduces, it would also mean that the insulin level in your blood too is going to reduce. And this is very, very beneficial. Because of this, there is no way for you to develop what we call insulin resistance. Insulin resistance, which in reality is the main cause of the metabolic syndrome. Now, when you practice intermittent fasting, you lose weight. And this is good for people who are overweight and obese. And what actually happens during this intermittent fasting is that you tend to burn fats, abdominal fat, and even the internal fat. You burn these fats to get energy. And because of that, you trim down and become slim and healthy. If you practice intermittent fasting, the cholesterol levels in your bloodstream are going to normalize. The triglycerides are going to normalize. The HDL, which is a good cholesterol, is going to increase. If you practice intermittent fasting, then you are not exposed to inflammation. We know that high levels of glucose in our bloodstream is the one that promotes inflammation. So when you do intermittent fasting, you are not going to have inflammation. When you practice intermittent fasting, then you will not develop cardiovascular diseases such as high blood pressure, heart disease, stroke, etc., etc. And if you practice intermittent fasting, then you can reverse type 2 diabetes. I say type 2 diabetes, not type 1, because type 1 diabetes, absolutely you will need insulin. But in type 2 diabetes, there is a possibility to reverse type 2 diabetes by practicing intermittent fasting. And of course, if you practice intermittent fasting and reverse type 2 diabetes, it means that all the different complications that are linked to type 2 diabetes are going to be shelved. For instance, we know that when you are having type 2 diabetes, you can develop blindness, you can develop a kidney failure, you can develop infections of the toes and then gangrene, and of course with the danger of amputation. Now, when you are practicing intermittent fasting, you are far away from this type 2 diabetes. The type 2 diabetes will be reversed and you will not develop the complications that I just cited. There is something again that is beneficial to us when we are doing intermittent fasting. There is something we call autophagy. Autophagy literally means self-eating. Now, what happens during autophagy is that when there are dead cells in the body has the capacity to recycle those dead cells. The body has the capacity to even eliminate cancer cells when you are practicing intermittent fasting. When you are practicing intermittent fasting, there is an increase in a hormone called the human growth hormone. And this hormone is very good hormone for the growth of the muscle and even the strength of the muscle. It is also good for the growth of the bone. If you practice intermittent fasting, then another hormone called the brain-derived neurotrophic hormone or factor is going to be secreted, and this is going to make your brain to function better and of course increase your mental clarity. We know that people who are addicted to glucose would eat many times in a day. They will eat even when they are not hungry. Now, when you are doing intermittent fasting, there is a hormone or two hormones that are secreted that are very, very helpful to you and that they are going to regulate hunger. These hormones are called ghrelin and leptin. They will help you to regulate hunger, and because of that, your cravings for carbohydrates or your craving to eat is going to reduce, and you will only eat when you are hungry. When you are doing intermittent fasting, again, ladies and gentlemen, there is benefits to your brain. Why? Because the fat in your body now is being converted into ketones. And these ketones are used by the brain. And when they are used by the brain functions better. Also, if you are practicing fasting, you are protected from developing degenerative diseases. And even the people who have already developed degenerative diseases, when they do intermittent fasting, the situation becomes better. For instance, people who are having Alzheimer's disease, people who are having Parkinson's disease, people who are having osteoporosis and all that. When you are practicing intermittent fasting, the situation becomes better. There is another thing that we call gut healing, and that is the healing of your digestive system, your pancreas, your liver. when you are doing what we call intermittent fasting, then your whole digestive system has the possibility to rest and repair itself from any damages. The pancreas will regenerate, and of course the liver is going to rest. Now, when I talk about pancreas regenerating, this is a study that they have found out that the pancreas can actually regenerate. And in future, this study might be beneficial even to people who are having diabetes type 1. Because if the pancreas can regenerate, it means that it will take over its function of secreting insulin again. So intermittent fasting is very, very important for such situations. The gut again, or the intestines, are going to rest and repair itself. And this will prevent you from developing what we call the leaky gut. Leaky gut means that if you eat so many times in a day, you will cause damage to your intestines. And your intestines now will become, they will not function again as expected because of the small damages that have been caused on it. And so we call it the leaky gut, because even food that is not properly digested will be absorbed into the bloodstream, even endotoxins. And when this undigested food gets into the bloodstream, it will go and provoke an immune reaction. And that immune reaction sometimes is manifested on the body by eczema, skin rash, etc., etc. So when you are practicing intermittent fasting, you are going to allow your digestive system to rest and, of course, recover from any problems or any damage that had occurred before. If you practice intermittent fasting, ladies and gentlemen, another advantage is that you are going to gain time-wise, economic-wise, and even energy-wise. How would it happen? If, for instance, you are practicing the OMAD, which means 1 meal a day, it would mean that you will prepare 1 meal and then you have only 1 session to eat. And of course, when you do that, you have the rest of the day that you stay without eating, and it is very, very healthy for you. When you do it like that, the window of fasting itself is increased, and it allows the body to rest. And then, of course, from a financial perspective, you have only prepared a meal, and meantime, you have only taken a short time to eat. Intermittent fasting also is going to help us to take out of certain diseases. I mean, before I talked about overweight, I talked about type 2 diabetes. And of course, ladies and gentlemen, if you practice intermittent fasting, the only thing that can happen to you is that it is going to let you have perfect health. And I would advise those people who need to practice intermittent fasting, except for some reasons, some condition, you are exempted from intermittent fasting. I would encourage other people to practice intermittent fasting. There is another video on who is not supposed to practice intermittent fasting. So, ladies and gentlemen, share this information and let as many people as possible get the information and start practicing intermittent fasting. Thank you and stay safe.